My Doctor, your health anytime, anywhere. Hello, lovely people. Welcome to the My Doctor podcast. My name is Mwesigwa Joy. I am a fourth-year medical student at Uganda Christian University, and I'm the president of the My Doctor community. We're very happy and delighted to have you listening in. And our main aim on this podcast is to equip you with basic knowledge on how you can live a healthy life, right? Want you to know what are the prevention strategies you can use, what are the signs and symptoms of different diseases, what can you do to live a healthy life. We also want to equip you with knowledge on the legal aspect of health. And today we're going to be diving into the technological aspect. So our topic for today is the use of artificial intelligence in healthcare. How can it influence healthcare? What are the benefits? Is it here to help the doctors or replace them? Yeah, so that's what we're going to be talking about. And I'm here with Mr. Niklas. You're very welcome, Mr. Niklas.
Thank you so much, Joy, for having me on. It's a pleasure. Thank you.
You're welcome. So could you please introduce yourself to our viewers?
Sure. So I'm Niklas. I'm from Germany. I'm a computer science student, and I'm working with My Doctor on a digital healthcare platform. So maybe I can talk a little bit about what we are doing with the platform. So basically, the platform consists of 3 different compartments. The first one is telemedicine. So what we are doing is we want to connect patients all over Uganda with doctors at My Doctor, especially patients who don't have easy access to healthcare. So this is via video call, like Zoom, but within the platform. And so they can ask questions, they can talk about their symptoms, and they can get advice and diagnosis by this doctor. That's the first compartment. The second one is AI healthcare chatbot, which is basically like ChatGPT, but just for health questions. So they are able to ask any sorts of health questions that they would normally ask to a doctor, just to the chatbot, just like you would chat with ChatGPT, basically. So this is our AI component, basically. The third component is a digital healthcare patient record. Basically, what it means is that for each patient that we have like a record of their medical history, like what kind of symptoms did they experience last year when they came to the hospital, but also like their demographics, like their age, their name, where do they live, all this kind of stuff, all in one record. So what this helps us is basically to deliver continuous care, meaning that care doesn't start from zero every time somebody comes to the hospital. So we are building this digital platform, and which combines the 3 different aspects.
Okay, thank you so much, Niklas. I'm delighted that we can have these conversations here because very many people have very many opinions about artificial intelligence. So I'd want us to drive back to just the definition of artificial intelligence for anyone out there who's watching. What is artificial intelligence in simple terms? Mm-hmm. Yeah. Okay,
so artificial intelligence, or AI, basically is we are giving a computer or a machine the ability to what we humans would define as think. So that means, so until recently, computers weren't able to think that way we call thinking. Like they were able to execute tasks that we tell them to do, like to do simple calculations or to print a document or whatever. Like the tasks we define for them, what they do. They're not creative. They don't create anything. So with AI, that changed. Basically now computers are also able to, let's call it, think on themselves. They're able to be creative. They are able to create something from nothing. And if you think about it, it's the first time in humanity that we are able to have something that is creative, that is not human. Because before it was always humans that were creative, that were designing new things, that were coming up with new ideas, with poems, with pictures, doing art and stuff. And now that changed because now AI is able to do that too. So basically, when you talk about AI, it's giving computers the ability to think, to reason. And there are 2 different types of AI I can mention. There's narrow AI and general AI, or artificial general intelligence, or AGI. So narrow AI basically means AI that is designed for one specific use case. So the AI is able to play chess very well, or drive a car, or write a poem or something. But that's just one specific task. And that's narrow AI. So general AI, or AGI, basically is intelligence like a human. So we humans, we are able to drive a car, we are able to cook, we are able to write a book, and so on. So that's basically a general kind of form of intelligence. We are not there yet. We don't have AGI yet, but that's like the next big milestone in AI research. So just saying, like, this space right now is very innovative. So there's a lot going on there. And yeah, so basically that's AI.
Okay, so in terms of healthcare, how best can we benefit from artificial intelligence? What are there any new developments or innovations that we can benefit from as in the healthcare system?
Sure. So let me first start. Like, AI is very good with data. So that means the more data we have, the better AI is. We humans, we are not good with data. Like, probably you know, Joy. Like when you have like a big Excel document, you don't see any pattern. Like we humans, we don't. But for AI, it's different. So it's very good with that, with data. So it can analyze data really quickly. It can find patterns within this data and make a prediction, for example. So let me give you just one use case for AI in healthcare. So you know about X-ray or MRI scans or CT scans. So what's until now, doctors had to go through each of these images of these scans manually and see if there's a fracture, for example, or if a patient has skin cancer or something. And AI can do the same thing. And not only the same thing, but it can do it much, much better. So actually the performance of AI with this kind of stuff, like image recognition, is much better than a human. So the accuracy is just much higher. That's one thing. And then the other thing is that just imagine like a doctor at 5 p.m. in the evening. He has his 100th patient of the day. He's tired and he often makes mistakes. Like a doctor can get tired in the evening. And for AI, that's not the case. AIs, they don't get tired, they're computers. So meaning the quality of their predictions, for example, they're all the same, like throughout the day. Like you can ask an AI at 3 a.m. in the night and the accuracy is still there. So that's just an example of how we can use AI in healthcare. Just one another example is a chatbot, for example. So that's what we are developing with my doctor. So it's basically just, we want to talk to the AI like you would talk with the doctor. So we can ask questions, we can describe our symptoms, and then we get, it tells us what we're suffering is, basically. So these are just 2 examples of how AI can help in healthcare in general.
Okay. I think let's dive into the chatbot that you've talked about. So for the chatbot, I would ask if I'm able to, so I can type in, if I have a headache, I type in I have a headache, I also have stomach ache, and then it will try and give me a diagnosis, right? Mm-hmm. Yeah. So isn't this, how accurate is it? Let's start there. Mm-hmm. How accurate is it? Right.
So we started, in general, we started developing it half a year ago or something. And back then, to be really honest, it wasn't very accurate. So it wasn't very good, but that's fine. I mean, that's the process of learning and becoming better. And so what we have been doing is we've been continuously training the chatbot on data, on existing healthcare data, African healthcare data. So it becomes better. It becomes better by training, but it becomes also better by just existing, by just being there and people interacting with it, by just patients asking questions. And that's how it learns also. So, so basically your question is how accurate is it? How good is it? So let me just go through how it works. So you just open a chatbot and in the background, the chatbot already knows you. So I talked about digital...
What do you mean it already knows you?
I talked about the digital patient records. And these are all the information that the doctor would have about you. So it's, like I said, it's your age, it's your size, it's your pre-existing medical history, all this kind of stuff. And this is what we feed into the chatbot already. So the chatbot not only knows your name and your age, but it knows all about your medical history. And this is important because if I go to the chatbot and tell him I have a headache and maybe I have a fever, then it is something else if I have diabetes and asking this question than if I don't have diabetes and asking this question. Just an example. So it's important that there's always some background knowledge for the doctor and also for the AI. So basically that's how it works. It knows about you, and then you talk about your symptoms, you say which symptoms you're experiencing. But then the AI can also ask questions dive deeper into the symptoms and then try to find out what you're suffering with. And at the end, if it thinks that it knows what it is, it can give you an answer. And this answer might be, you just have to rest and drink water, but it might also be, it's more serious, you have to go to a doctor and see a doctor.
So what inspired you to start the chatbot, and what gap are you trying to address with the chatbot? Yeah.
So there's a big problem in African healthcare and Ugandan healthcare, and that's a big patient-doctor gap. So right now, Uganda and Africa is experiencing this big gap. which means there's one doctor for 25,000 patients. So it's a big gap. And it's especially a big gap in Africa and Uganda. So that's a big problem that we are facing in Uganda and we are trying to tackle with my doctor. So basically what this gap means is that a lot of people, especially in rural areas, are not able to access healthcare information, but also treatment. So what we are trying to do is we're trying to help with this problem. We're trying to solve this problem. I talked about the telemedicine aspect. And this one helps in the way that somebody, let's say in a rural area in northern Uganda, he wants to ask a question to a doctor. He's experiencing some symptoms. So what he would have to do is he would have to take a boat or something and drive to the next hospital, which is maybe 50 kilometers away or 100 kilometers away. And it's very expensive, the transportation, and maybe he doesn't have time for that. So when we come up with the telemedicine aspect, we're basically saying, okay, you can just stay at home as long as you have a phone and just talk to our doctors who are here in Kampala. So you don't have to travel to any hospital. So basically we're trying to bridge this gap and connecting the patients to these doctors. And that's the same with the chatbot, basically. So if I have a simple question as a Ugandan patient in a rural area, for example, I don't have to drive to the next hospital. I can just ask this chatbot and maybe the question is answered within 2 minutes, so I don't have to waste all my day and a lot of money to go to a hospital. So basically this patient-doctor gap, this is what we're trying to address, and that's why we built the chatbot and the whole platform for.
Okay, so these innovations sound interesting, but it seems like the healthcare system sometimes looks like it's not ready to embrace them. The public can, but the doctors sometimes feel threatened that artificial intelligence is here to take their jobs. Because if you're telling me that this chatbot is going to tell me what I'm sick of, chances are I may self-medicate. I may go to the pharmacy and just buy what I need. So is that true? How accurate is that? Are they here to replace the jobs, or are they here to complement, and just for reassurance to the health workers that AI is here to help?
Sure.
Yeah.
That's a very, very important question, a very good question. So first of all, in general, AI in healthcare. So like I said, I was talking about that AI is much more, in some cases, much more accurate. It's much better, so to say, than a doctor. For example, it doesn't make so many mistakes. It doesn't get tired. It gives instant responses. So in some cases, it's true. It does a better job. So then why don't we just do only AI? That's the question. So, and the answer to this is just we're humans. We want human contact. We want human interactions. So I don't know about you, Joy, but I don't want to go only to an AI doctor and ask this AI doctor all my questions without ever seeing a real doctor. I don't want it. I want a human contact. I want to to talk to a real person and maybe ask follow-up questions and just a human contact. So I think not a lot of people only want AI as their doctor. So this, in my opinion, this won't happen. So then why don't we just leave AI completely out of there? So that's what I've always said. AI can really help doctors. It can make a better decision than some doctors in some cases. So I think, in my opinion, the best solution is to work hand in hand, like a doctor and AI. The AI more as an assistant of the doctor, but the patient interacts with the doctor. It doesn't only interact with the AI. Yeah. That means you can go to your doctor and tell him about your symptoms, for example, and then this doctor can use AI also to help you with your problem. But you're still talking with the doctor because you, like I said, you don't want to lose the human contact at all. So this is one thing. I think, in my opinion, it will go hand in hand. It won't be either doctor or AI. It will be together. As for the chatbot, also with the chatbot, we're not trying to replace any doctors at all. We know that, like I said, humans, we don't want to only talk to an AI chatbot. Yeah. But sometimes it's just easier to if I have a quick question, one small question, I wouldn't go to the hospital because it's a long distance. I have to wait long and this kind of stuff. So what I can do is I can just ask the chatbot this one small question, and maybe it's answered instantly. And if it's something bigger, then I go to see a doctor. Right. Okay.
Then maybe another question I would have is, when you go to the hospital and maybe a doctor makes a mistake, you know the doctor is liable. Now, in regards to AI, I've asked the AI chatbot, it has made a terrible mistake. Yeah. And then, so who is responsible for that mistake?
Yeah. So this is a very important question in AI in general. Let me just give you another example. Like, for example, self-driving cars. Like, we don't have them yet in Uganda, but for example, in Europe, they are there, or in the US. So the question is, if this car is on self-drive mode and it runs over a pedestrian, like, who is responsible for this pedestrian who has to go to the hospital to get his leg fixed or something? Who's responsible? Is it the AI? Is it the developers of the AI? Is it the car maker? Is it the person just sitting in the car? Like, who is responsible? And to be really honest with you, there is no definite answer for this. Like, every country itself has its own laws regarding this. So we can't say it's always the AI or it's always the developers. It depends. So AI is relatively new, as you know. Yeah. So right now we haven't figured it out as a society yet, I think. As for healthcare, as for this case, or for my doctor chatbot, so the chatbot is developed together with doctors. So it's not me sitting there feeding some data in there and that's it. We're developing it together with doctors, meaning these doctors are testing it continuously and trying to find out if the answers that the chatbot is giving are good, if the answers are correct. And if they're not, we try to iterate. We try to refine the chatbot, basically. We try to train it again. And in general, like, if there's something that, okay, if you tell the chatbot about your symptoms and it comes out that it's something that is very easily treatable by yourself, like you just have to rest, drink water, and sleep, I don't know, something like this, then the chatbot will tell you that. But it won't tell you to go get some medicine, some medicine from the pharmacy. That's not what it's going to do. So like I said, if it's a serious thing that can't be fixed by yourself, the chatbot will tell you what it probably is, but it won't tell you how to fix it. It will tell you, okay, you have to go see an actual doctor. And the good thing about our chatbot it's already automatically like giving you the context to your next clinic. So as soon as the chatbot tells you have to see a doctor, below the chatbot you'll see appointment booking system, so you can book an appointment at your closest hospital, basically, to see an actual doctor. So you see, like, we're not trying to replace any doctors. We're just, for easy questions that are treatable by yourself, you just don't have to drive all the distance to the hospital. But for serious questions, you still have to see a doctor, obviously.
Okay, thank you so much. So earlier we talked about entering data into the system so that the chatbot already knows Joy, she has this, she has that. So how safe is my data? Like, how private is that AI chatbot? Because I wouldn't want my data to leak at any point, or I have this condition. So how private and how safe is it?
Mm-hmm. So this is also really important because, so in my opinion, like, our healthcare data is like our most sensitive, most important data that we have as humans. Like, even more important than our bank details, maybe, like, because it's affecting our health. So it's really important that we make sure that this data stays where it belongs and doesn't fall into wrong hands. So one thing we are doing to achieve that is by just having the highest standards of data protection. So the data is really stored securely, and also it's stored anonymized, meaning that if you just see the data, you can't say, okay, that's Joy. But so you see, like, so what we are basically doing, like, we have one table, so to say, of the names and one table of the health data. That's maybe your gender, that's your pre-existing medical conditions, all this kind of stuff. And they're stored separately. It's a little bit technical right now, but what this achieves basically is that the data is stored securely, so that if you have one table, you can't say, okay, that's Joy, these are Joy's pre-existing medical conditions, this kind of stuff. So our data protection is we're trying to do it very strongly. But that's only one part. The other more important part is that we give the users, the patient, full control of their data. So they are able to modify all the data they want. They are able to tell us which data they want to have stored. And they're able to delete every data that they have by just pressing one button. So we want to make it really easy for them to have full control of all their data. Yes.
Okay, so as we come to the end, I'm really excited about the chatbot and the telemedicine and the whole system. So could you give us, like, a little bit of more detail on when maybe it's going to be launched, and when it's launched, how can people access it? Will it be an app? Will it be a website, a link? How best can we use it as Ugandans, and when is it getting launched? Yeah.
The idea is that we have a website. It's a web platform. So it's accessible by a computer, by a PC, or by your mobile phone, by a smartphone. So on this platform, we have, like I said, the telemedicine aspect. You can schedule appointments with the hospital, also our partner hospitals all over the country, and we have the chatbot there. So it's a website basically at first. So regarding the launch date, we are not 100% sure when this will be, but probably 2 months, 3 months. So we first will launch this with our existing customer at My Doctor, so that we basically sign up all willing customers to the platform. And they are able to use and test it. So they can play around with the chatbot, they can use the appointment scheduling tools, they can use the telemedicine aspect to talk to the doctors and this kind of stuff. One thing I didn't talk about yet was a lot of people in rural areas in Uganda, they don't have access to the internet. They don't have a smartphone, they don't have a laptop. So what we are trying to do is we want to use SMS for this. Like as a shortcode, you just dial a shortcode and then you're able to talk to a doctor with SMS basically. You can ask questions by SMS and you get the diagnosis, the answers by SMS. Same for the chatbot basically. You can chat with the chatbot just by SMS, like you would with a normal person, like with another person. Ask questions, talk about your symptoms and get a diagnosis. So like for these people living in rural areas, we want to use this SMS feature basically for them to access it. Yes, so yeah, we're really excited to soon launch it, hopefully as soon as possible. And yeah, we'll let you know when we launched it.
Okay, we can't wait. Also, what language, when you're talking, I thought about what language is it going to be in? Is it English? And if like I want to talk to a doctor, I'm in a rural area and I only know a local language, is there a possibility to talk to the doctor in a local language?
Yeah, so right now we have it in English, especially the chatbot, but also in Uganda. Okay. So these two languages we have for people who don't speak English that well, they can use Uganda basically for the chatbot. For the telemedicine, I mean, most doctors at My Doctor, they know Uganda, so it's easy for them. But like for the chatbot, it's in two languages, English and Uganda. And they can choose which language they want to use. Interesting.
So we have come to the end of the podcast. Thank you so much for coming to tell us about artificial intelligence. I'm sure we have learned a lot. So I would want you to give like closing remarks. Is there any message you have for the people about artificial intelligence in healthcare? Yeah.
So one question you had, Joy, was about if we are trying to replace doctors, basically. And like I already said, this is not really the case. I know where this fear comes from and I can absolutely understand it. But like I tried to explain, that's not what we're trying to do. What we're trying to do is we want to make patient-doctor connection as easy as possible. Long-term, AI in healthcare will be AI assisting doctors. It will be AI working alongside doctors hand in hand. It won't be replacing doctors totally. That's nobody wants that, to be honest. So basically, we at My Doctor, what we try to do is we want to, like I said, just make this patient-doctor connection as easy and accessible as possible, especially for people on the countryside who don't have easy access to care. Okay.
Thank you so much, Niklas, for coming.
Thank you, Joy. For the pleasure.
We're very happy to hear from you and we can't wait for the chatbot to be launched and the telemedicine aspect. Thank you so much. And to our viewers, thank you so much for listening this far. Hope you've learned something about artificial intelligence. It's not here to take away our jobs. It's here to assist us, right? It's here to assist us. It's here to increase on the accuracy and just make the whole experience better. So I think we should try and embrace it. And yeah, if you have more questions about artificial intelligence, you can feel free to put them in the comment section and yeah, we'll be sure to reply to them. Thank you so much for watching this episode. This is My Doctor, your health anytime, anywhere.
My Doctor, your health anytime, anywhere.